Hello, future nurses. Now we will go over Chapter 36 in your F.A. Davis book, 3rd edition. Administering medications using the 7 rights is a huge responsibility. Over the next few chapters, we will go over the different routes through which medication can be taken. In this chapter, we are going to discuss medications that are administered via oral, topical, and mucosal routes. Tablets are the most common form of oral medication. They are made of powdered ingredients compressed into various sizes and shapes. They can be swallowed, chewed, or disintegrated on contact with saliva. Most tablets are made to be swallowed. Others may be designed to dissolve in buccal cavity, that is between the cheek and gum, or sublingually, under the tongue. Enteric-coated tablets have an outer coating that does not dissolve until it reaches intestines. The coating can protect stomach from irritating ingredients that can cause nausea, vomiting, and ulcer formation, and also keep certain medications from getting destroyed by stomach acids before the medication gets to the intestines. Sustained release tablets are designed to slow the absorption of the drug. They are also known as controlled release, delayed release, extended release, or modified release. Do not crush or break sustained release or enteric-coated tablets. Caplets are similar to tablets but just oblong in shape. Capsules are gelatin shell containing powder or pellets of medication. If patient is unable to swallow a capsule, the shell can be opened and the contents can be mixed with 1 to 2 teaspoons of soft food such as applesauce or ice cream. You don't want to put the whole medication in a full serving of ice cream or applesauce as the patient might refuse the whole serving. Liquid medications include syrups, elixirs, solutions, and suspensions. Always shake the liquid medication if it is a suspension or if settling has occurred. We commonly use the Latin abbreviation PO for oral medication. Here you can see an oral tablet being placed in the buccal cavity and sublingually. While pouring liquid medication into a medicine cup from a bottle, hold the medicine cup at your eye level. You will notice that the top of the liquid is not level, but instead curves up on the sides and is slightly lower in the middle. This portion is called meniscus. When reading the amount of liquid in the medicine cup, read it at the lowest level of the meniscus. For infants and young children, calibrated droppers or syringes may be used. At times, you may have to hold oral medications for your patient. For example, if the patient is NPO or can have nothing by mouth, do not administer routine medications by mouth unless ordered by the provider. If the patient is nauseous or is vomiting, you should hold the medication and inform the doctor. Narcotics are medications that have opium and opium derivatives that control and relieve pain. They are controlled substances that may be administered orally, topically, intravenously, or as an injection. There is a high potential for abuse and thus they are regulated by law according to schedules. When prescribed for pain by the healthcare provider, it is appropriate to administer the medications. Assess the patient's pain level. They may have different orders based on pain level. For example, the provider may have ordered a less potent medication for pain level from 4 to 6 than from 7 to 10. Assess the vital signs. Narcotics can depress the respirations and lower blood pressure. You want to count the narcotic medications at specific times. In long-term care, it may be done at every shift change. In acute care, it may be done weekly. Discrepancies need to be resolved. If unresolved, the nurses may need to stay on the floor until it is resolved, or a drug test may be needed. If a full dose of narcotics is not used, discard the unused narcotics and record the waste per facility policy. Typically, another nurse has to witness the waste. Record the waste appropriately and have the other nurse sign as a witness. Enteral tube routes include nasogastric, NG, or gastrostomy or PEG tube. Tablets need to be crushed and mixed with 20 milliliters of water. Pill crushers are typically used. If allowed, capsules can be opened and mixed with water or juice. Consult drug book and pharmacist to determine which medication may or may not be opened, crushed, mixed with formula, or administered via enteral tube. Medications may interact with tube feeding formulas. This can lead to decreased effectiveness. Some medications are known to cause clumping, leading to obstruction in some cases. These meds should not be administered via enteral tube feeding. A list of these meds are available in your book in box 36.4 on page 801. Each medication should be administered separately. Flush the feeding tube with water before medications, between medications, and after medications. For older adults, we may need to crush medications and mix them in 1 to 2 teaspoons of applesauce or ice cream. If medications cannot be crushed, then we should obtain an order for liquid medication. Older adults are more sensitive to medication effects and side effects because of their aging. It's important to assess frequently for toxicity and non-desired effects. Generally speaking, elderly people take multiple medications for chronic conditions. We need to be alert for possible interactions with other drugs, supplements, and herbal remedies. Older adults are highly prone to contracting adverse drug reactions as well. It's important to monitor lab results to determine if medications should be held and the prescriber should be consulted. It is difficult at times to get infants and children to take medications. Using oral syringe is recommended because it offers more accurate dosing and it is easy to use. Place the syringe towards the back of the mouth in the cheek pouch and depress the plunger to administer the medication. The amount of medication ordered for children is generally a fraction of an adult dose. The dosage should be double-checked for patient's weight, typically ordered in milligrams per kilogram of body weight. Overdosing can easily occur. If a child refuses a medication because of the taste, speak with the pharmacist about adding a favorite syrup to it. Topical route of administration involves applying a drug to the skin or mucous membranes. Topical drugs typically are used for their actions at one specific site. A thin coat of medicine can be seen to the affected area after application. Some medications need liberal application or a thick coat of medication. Use cotton-tipped swab or tongue depressor to apply the medicine. Do not touch the opening of the tube to the patient's skin to avoid contamination. Wear gloves. Depending on the medication, you may or may not need to cover it with dressing. Drugs may be absorbed through the mucosal route in the eyes, nose, rectum, and vagina. This route is sometimes preferred because the drugs enter directly into the bloodstream with faster onset of action. Place eye drops in the middle part of the lower conjunctival sac. Have the patient tilt his head and look upward. Gently pull the lower lid down to expose the sac. Gently brace your hand against the patient's forehead or cheek to prevent injury to the eye if the patient moves his or her head. Administer the drop of eye medication into the conjunctival sac. To apply eye ointment, gently squeeze a line into the conjunctival sac. Instruct the patient to close his or her eyelids and move the eye around while keeping the eyelids closed. Avoid applying pressure to the eyeball at all times. Also avoid touching the tip of the tube or dropper to the patient's eye or skin to prevent contamination by pathogens. A tissue may be used to wipe from inner to outer part of the eye along the eyelash. Advise patients not to rub their eyes after applying eye drops or ointments. Ear drops may be administered to soften cerumen, relieve pain, treat infection or inflammation, or facilitate removal of a foreign object. With patient lying on his or her side with the affected ear up, pull pinna up and back for adults and children over 3 years of age. Pull pinna down and back for children younger than 3 years. You may get orders for eye and ear irrigations for your patients. This is done to flush away debris and contaminants or to remove a foreign body from the eye or ear. Irrigations are contraindicated for removal of foreign body that could absorb fluid and enlarge. Nasal sprays can be administered to reduce inflammation, facilitate drainage, or treat infections in the nasal cavity. They have a rapid absorption into the bloodstream. During administration of nasal sprays, position the patient with head flexed forward so that the spray enters the sinuses and does not go down the throat. Medications may come in the form of suppositories, creams, aerosol forms, or tablets. Pre-filled applicators may be used to treat local yeast infections, vaginitis, endometrial atrophy, and contraception with spermicidal agents. Lubricate the suppository prior to use. Patients should stay lying down 5 to 15 minutes to facilitate medication absorption. Medications administered via rectal routes are available in suppository or enema form, ointments, and creams. Hydrocortisone suppository is used to treat local swelling and inflammation associated with hemorrhoids. Diazepam rectal gel can be used for epilepsy. Dulcolax suppository is often administered to stimulate bowel movement in constipation. Kayexalate enema is given to treat hyperkalemia. Be aware of patient status before administering any medication through rectal route. For example, if the patient has had a history of cardiac arrhythmias or just had myocardial infarction, giving a suppository may stimulate the vagus nerve and trigger dysrhythmias. You want to lubricate the rectal suppository before administration as well. Medications given via respiratory route are dispersed in fine droplets and inhaled into the lungs and bronchial airways. Typically, inhalers and nebulizers are used to treat pulmonary conditions. Nebulizers use compressed air force through the liquid medication, resulting in a mist that is inhaled into the bronchi and bronchioles to dilate them. Bronchodilators open constricted airways and include albuterol and ipratropium bromide. Metered dose inhalers, or MDIs, are pressurized medication dispenser. They are the most efficient means to get medications into the lungs. Short-acting bronchodilators can be used in acute asthma attack. Anti-inflammatory agents and bronchodilators can be used for long-term asthma management. MDIs should not be left in the car because heat may cause them to explode or rupture. Dry powder inhalers, or DPIs, rely on the force of the patient's own inhalation to dispense a dose of dry powder medication. Discus inhalers are frequently prescribed. Patients should not exhale directly into the DPIs as that will disperse the medication. Assess the patient for the appropriateness of medication administration. For example, get patient's health history for any complaints. Ask them if they are taking any medications for the stated problem. Check all lab results to determine if it is safe and appropriate to administer an ordered medication. For example, warfarin or Coumadin is an anticoagulant and can cause bleeding from orifices if the therapeutic levels are exceeded. For this reason, we have to check prothrombin levels or pro-time or PT and international normalized ratio or INR prior to administration. If it is above the therapeutic range, hold medication and call the provider. Always check drug allergies prior to administering any medication. See if you have to check the ingredients in a combination drug. For example, a patient allergic to sulfa medications should not get combination antibiotics containing sulfa, such as trimethoprim, sulfamethoxazole, commonly known as Bactrim. Similarly, they should not get the topical medication silver sulfadiazine, commonly known as Silvadene. Check the timing prior to administering medications for appropriate administration. Especially when you're dispensing PRN or as-needed medication, you want to ensure that you are within the correct window of administration. Depending on the facility, you may have to document medication administration on paper or electronically. While electronic MARs are being used more widely, there are still some places that use paper MAR. There is potential for errors to occur during transcription of medication orders, especially on paper. Always read the order carefully before administering medications. It is imperative that we document accurately even when we are withholding medications or if the patient is refusing medications. Often, patients and residents are refusing medications. We can encourage them to take the medications by teaching them about the desired effect. If, however, patient continues to refuse medication, do not force the issue. Document all your actions. Notify provider if a medication is being held or is being refused. Document the prescriber's name and the prescriber's response. In order to prevent errors, you want to check the original prescriber's order against the order on the MAR. Check frequently for new or changed medication orders. Read medication orders very carefully. Look up any unfamiliar medication. Be certain that it is appropriate to administer the medication. Always perform 3 safety checks for your medication administration. Ensure that you follow the 7 rights of medication administration. Question any orders that exceed the recommended dose. Document medications. Check carefully for discontinued orders. Carefully supervise any unlicensed person. In case a medication error occurs, you want to put the patient's safety first. Notify the prescriber and explain what happened. Carry out additional orders for assessing and monitoring the patient's response. You want to complete an incident report, and you want to avoid being too hard on yourself or other nurses. Medication errors are very distressing to nurses. Be a supportive team member and try to brainstorm solutions to problems that might lead to medication errors in future. This brings us to the end of our chapter. If you have any questions, just send me an email or bring them to class and we will discuss. Thank you for listening. See you in class.